Metabolic keys. Benefits and SSDI updates. SSDI is not awarded just because a diagnosis is serious. The system is asking two questions at once: whether you are insured under the program and whether the record shows work-limiting disability under Social Security rules. Research priority. Verify current claims against U.S. government websites for benefits topics and against the American Diabetes Association or other major primary institutional sources for diabetes and metabolic health topics. A lot of people start looking into SSDI only after health problems begin limiting work in a serious way. That means they are often learning the system at the same time they are dealing with fear, exhaustion, paperwork, and income pressure. The result is confusion fast. The first thing to understand is that SSDI is not simply about having a diagnosis. It is a disability insurance system with its own rules about work history and medical limitation. When someone applies for SSDI, two big questions matter immediately. First, do they have the work history to qualify for the insurance side of the program? Second, do their medical conditions limit work strongly enough under Social Security's rules? Those are not the same question, and people often lose time because they think one automatically proves the other. A diagnosis can be real and serious while the record still fails to explain clearly how work capacity is limited. On the other side, severe functional limits do not create SSDI eligibility if the work credit side is missing. The SSDI process feels hard because people are trying to translate private suffering into public evidence. You may know exactly how much fatigue, pain, neuropathy, cognitive slowdown, shortness of breath, or treatment burden is affecting your ability to work. But the application is not judging feelings alone. It is judging whether the record shows an insured worker with medically documented limits that matter for work capacity. That can feel cold, but understanding that standard helps people focus on what the file actually needs, instead of assuming the system can somehow infer the whole story. Imagine someone whose diabetes complications, fatigue, neuropathy, pain, or other chronic conditions have made consistent full-time work much harder. They may already know their life changed, but the system is not watching their life directly. It is watching documents, treatment records, function descriptions, work history, and the consistency of the evidence. That gap between lived reality and documented reality is where many applicants get lost. One of the biggest mistakes is assuming the condition name alone will carry the application. Another is filing without understanding how daily functional limits need to be described. SSDI is not just asking whether you are sick. It is asking what you can still do, what you cannot do reliably, how often symptoms interfere, and whether the record supports that picture over time. Many applicants underestimate how much clarity matters. They assume the system will naturally understand that repeated hospital visits, unstable blood sugar, chronic pain, fatigue, medication side effects, or mental strain obviously affect work. But disability files are built from records, forms, and descriptions. If the file is fragmented, the reality can be fragmented too. That does not mean people are doing anything wrong. It means the system is imperfect, and applicants have to learn how to translate their lived limits into a record that is coherent enough to evaluate. Stronger documentation is specific. It is the difference between saying, "I have back pain and diabetes," and saying, "I can stand for only short periods before pain increases, I need extra breaks, neuropathy affects balance, fatigue reduces concentration, and symptoms have made full-time attendance unreliable." The goal is not dramatics. The goal is functional clarity. Applications become easier to understand when symptoms, treatment history, and work limits line up in one coherent picture, instead of sitting in separate disconnected notes. Organization sounds boring until you realize how many SSDI problems are really record problems. A claimant may have a legitimate health situation, but if provider names are wrong, dates are missing, symptoms are vaguely described, or key records never get attached, the system becomes harder to navigate. That is why simple organization matters so much. A notebook, folder, spreadsheet, or timeline can function almost like an accessibility tool. It helps the applicant communicate under stress. It helps them answer questions consistently. It helps them notice when something important is missing. When people understand that, they stop seeing organization as clerical busywork and start seeing it as part of protecting their own claim. A stronger application starts with organization. Know your treatment providers, know your medication list, know your work history, keep track of appointments, testing and diagnoses, be ready to describe limitations in ordinary terms. Standing, walking, concentrating, lifting, using hands, staying on task, needing breaks, or missing work because of symptoms. If the condition changes over time, that timeline matters too. For many applicants, the practical work is not proving they are suffering. It is making sure the record clearly shows how health limits function. If you are early in the process, start by creating a clean file for yourself. Gather provider names, dates, medications, test results if you have them, and a plain language summary of how your condition affects work. Keep contact information current. Open and respond to mail quickly. If your situation is medically complex, ask what additional records or clinician documentation would actually strengthen the file instead of assuming the system already sees the whole picture. Clarity beats volume. After filing, keep watching the process. Check whether your contact information is still correct. Watch for forms or calls that need quick response. Notice whether recent treatment or testing still needs to be added. If your condition worsens, the file may need to reflect that. If you move, change phone numbers or change doctors, update that quickly. Many preventable problems happen because people think the application is now on autopilot. It is not. It still needs your attention, even while it moves slowly. This process becomes even harder when the same symptoms that make work difficult also make paperwork difficult. Fatigue, pain, brain fog, low energy, unstable blood sugar, depression, and repeated appointments all make system navigation harder. That is an important reality because it explains why strong applicants still get overwhelmed. The answer is not self-blame. The answer is structure. Reduce the number of places information can get lost. Keep one list of providers. Keep one running symptom and function note. Keep one place for letters and deadlines. The less scattered the process becomes, the less likely the file is to drift away from reality. Plain language matters here because a lot of applicants are reading while exhausted, scared, sick, or financially stressed. If the explanation is buried in legalistic language, people miss the practical point. What they need is a map they can actually use. What SSDI is checking, what evidence matters, what function means in daily life, and what actions reduce preventable mistakes. A good benefits explainer does not oversimplify the system into a fantasy. It makes the real system readable enough that people can act on it. That is one of the highest value forms of information, because clarity changes whether someone follows through effectively or gives up in confusion. When health limits work, SSDI can look intimidating because it is both a medical and a system navigation problem. But the process becomes more understandable when you break it into the right questions: insurance eligibility, medical evidence, functional limits, and documentation that matches reality. Once you see the structure, the next steps become easier to organize.